Hi, my name is Sun Ku Yu. I'm going to talk about hypertension in Asian Americans affected by various factors. This is content I'm going to go through. Hypertension. Hypertension is the main risk factor for the loss of disability to adjust the life years, and it is one of the leading causes of morbidity and mortality. And also, it is a risk factor for cardiovascular disease and organ failure. Prevalence of hypertension. 1 billion people in the world in 2010 had hypertension, and it is expected to increase to 1.5 billion people until 2025. 29% of adult population in the US in 2015 and 2016 had hypertension. Asian population. Asian population is the largest single ethnic group in the world. They are the fastest growing ethnic population in the US. 5.6% of the population and 36% of immigrants in the US are Asian population. Aspects of Asians. They are generally considered the healthiest ethnic group. They have the longest life expectancy, 85.8 years, and cardiovascular disease such as stroke, MI, and peripheral arterial disease are the leading causes of death in Asian Americans. Although Asian Americans are less likely to be overweight, but they are more likely to be risky to have chronic disease at lower body mass index level. Hypertension in Asian Americans. The prevalence of hypertension in Asian Americans was 28.7%. It is very close to 29%, which is the general adult population prevalence of hypertension of US. And uncontrolled blood pressure is strongly associated with higher risk of cardiovascular disease in Asians. Asians with hypertension had 4.5 times more likely to have cardiovascular disease than Asians without hypertension, and they have about 2.1 times more likely to have cardiovascular disease than Oceanian people with hypertension. This is 7 traits of Asian Americans, why they have hypertension at lower level of BMI. Diet. DASH diet and the Mediterranean diet are 2 well-known healthy diet patterns reducing hypertension like dyslipidemias. And in addition to them, dietary guidelines for Americans and Koreans dietary patterns are also known as a health diet. They decrease cardiovascular disease risk factors, including total cholesterol and LDL cholesterol significantly. Asian immigrants in the US changed their dietary patterns more likely to American style that is more associated with chronic disease such as diabetes, obesity, hypertension, as they live longer in the stage. They are eating less rice and consuming more fat and meat. Longer residence in the stage is associated with higher chance to have hypertension. So there is a study done to show this trait. Korean adults in Korea over 45 years old has 13.4% of hypertension. Koreans living in the stage less than 15 years had 12.5% of hypertension, and Korean living in the stage more than 26 years, they had the highest prevalence, 23.1%. Physical activity. Recommended physical activity is 150 minutes per week, 30 minutes of brisk walking for 5 days with muscle strengthening exercise twice per week. Asian Americans were less likely to meet adequate physical activity level. They have 50% less likely to meet the 150 physical activity guideline comparing to other racial groups. Because of that, higher fat weight caused by lower physical activity might contribute the risk to have chronic disease at lower BMI. Asian Americans' children also show that poor aero capacity level. The passing rate of Asian American children for health fitness standard is only 29% compared to 37% of other groups. It is strongly linked to children obesity. Level of obesity is significantly associated with incarceration and longer lengths of residency in the US. So longer residence of US associated with less physical activity and an unhealthy diet as well. Lifestyle. Health lifestyle behavior are more difficult for all races to follow than taking medication since they need more time, effort, motivation, and support. Asian Americans are least likely adhere health lifestyle behaviors among them. They they are less likely to meet the physical activity recommendation, and they are less likely to strict salt consuming in their diet, even though their smoking rate is lower than other races. Social trait. Less health insurance coverage. About 70% of Asian Americans covered by private insurance, comparing to 76% of non-Hispanic white American have insurance. About 8% of Asian Americans are uninsured, comparing to 6% of non-Hispanic white population in 2015 had no insurance. Hypertension is chronic disease which needs constant and persistent care, but because of a lower health insurance coverage, constant care for hypertension of Asian Americans are not easy. Asian Americans without insurance were 1.9 times more likely to die than Asian Americans with private insurance in trauma center. So health insurance is very important managing chronic disease and trauma as well. Hormones. Adiponectin is mainly produced by adipocyte, and lower level of adiponectin is associated with higher incidence of diabetes and cardiovascular disease. And leptin is also mainly produced by adipocyte, and it reduces appetite and increases energy expenditure. It has cardiovascular effect, possible blood pressure elevator. Asians have a lower adiponectin and leptin level. Lower leptin level has a protective, it is a protective factor for cardiovascular disease, but Asians are more likely to have high blood pressure than Caucasian at the same BMI because significantly lower level of adiponectin than leptin. Other traits, genes such as CYP17A1 and FGF5 and CSK genes are significantly associated with higher blood pressure in Asia. Stress. Emotional stress such as anxiety is a significant causative factor of arterial stiffness that is related to hypertension in Korean Americans. And there is a positive association between working hours and self-reported hypertension in Japanese American as well. About 74% of Asian Americans are religious people. So faith-based organizations such as churches, mosques, temples, and gurdwaras can affect community health positively by providing health promoting services such as healthy food policies and hypertension management coaching program. There are some barriers. Now, health insurance coverage rate of Asian Americans is lower than the average rate of the US. This prevents them from seeking for medical services or access. And language barrier leads infrequent medical visit and poor health care to Asian Americans. About 76% of Asian Americans don't speak English at home. About 50% of Chinese and Vietnamese reported they don't speak English very well. So here is the conclusion. Asian population is generally considered the healthiest ethnic group. However, they are more likely to have hypertension and lower BMI. Hypertension is strongly associated with cardiovascular diseases, and they are the leading cause of death in Asian America. There are many contributing factors for Asian Americans to have high blood pressure, such as salt diet, westernized diet, lack of physical activity, lack of health insurance coverage, lower concentration of cardiovascular protecting hormones, lack of English proficiency. Various financial and cultural barriers prevent Asian Americans from healthcare access and services. But cooperation of policymaking has promoting education, cultural sensitivity, improved healthcare services access is very necessary to address this issue thoroughly, although this might require time and effort. Thank you so much for watching.